Today's headline: CDC puts the Bundibugyo outbreak at 378 confirmed cases. Welcome to Ebola Watch.
Here's Deleo El Zomahun at MMWR.
In May 2026, a large outbreak of Bundibugyo virus disease was identified in DRC and Uganda. As of June 2, a total of 378 confirmed cases and 63 confirmed deaths have been reported. No cases have been reported in the United States.
The MMWR notes from the field landed yesterday, and I want to be precise about what this is. It's the first formal CDC epidemiological write-up of the outbreak, peer-reviewed in the public health sense, authored, citable. A situation report tells you where things stand. This one tells you how the case definition reads once CDC puts it on paper.
Okay, but practically, does an MMWR write-up change what the US actually does? Or is this the paperwork catching up to what everyone on the ground already knew?
Mostly the latter. And I don't mean that as a knock. It sets the official confirmed versus suspected breakdown as of June 2nd, the numbers other agencies now get measured against. After that $518 million plan, this is the document that pins the baseline down.
And Bundibugyo specifically. The MMWR notes this strain's only caused 2 prior outbreaks in DRC and Uganda. So we're not exactly in well-trodden territory with this virus.
CIDRAP, with Joel Mbala.
The World Health Organization, WHO, and the Africa Centers for Disease Control and Prevention, Africa CDC, today announced a joint plan to respond to the Ebola outbreak in the Democratic Republic of the Congo, DRC, and Uganda over the next 6 months.
The big number today is $518 million over 6 months, through November. Tedros framed it as one plan, one budget, one team, which is aimed right at the problem we were circling earlier this week. Who's actually in charge of this response?
So that's the May 15th coordination call finally cashing out. We kept asking whether anything came of it. Now there's a budget and a timeline attached.
Partly, yeah. But read the CIDRAP figures carefully. 381 confirmed cases, 62 confirmed deaths in DRC, 16 confirmed and 1 death in Uganda. CASEA puts the case fatality rate at 15.9%, and then notes there are still more than 250 suspected deaths sitting outside that number.
250 suspected deaths, not in the 15.9. Sarah, if even half of those confirm, the fatality picture moves hard.
Which is why the confirmed versus suspected line matters every single time. A 15.9% CFR is real for the cases we've classified, but it isn't the ceiling, and the plan has to be funded for the messier picture, not just the clean one. From Joan Babazi at the New Times.
East African Community, EAC, health ministers have announced coordinated measures to curb the ongoing Ebola virus outbreak, including harmonized screening at borders and the creation of a regional task force to strengthen surveillance and response.
So this is the one we've been waiting on all week. The May 15th urgent call. EAC ministers met June 1st and 2nd, and now there's harmonized border screening and a regional task force on the record. The meeting actually produced something.
It produced a communique, Daniel. Standardized checks at airports, seaports, and land crossings, in line with WHO guidance. That's the language. The word to listen for is standardize.
Meaning what? That harmonized could be one shared protocol, or it could be 7 countries agreeing in principle to do their own thing.
It could mean one threshold for flagging travelers, one data feed, one case definition. Or it could mean each capital runs its own screening and agrees to talk about it. The communique doesn't settle that. Either way, the DRC-Uganda bilateral channel now sits inside this bigger multilateral frame. This one's from CDC.
CDC is working with international partners on this evolving situation. CDC has taken proactive measures to prevent Ebola from entering the United States. To date, no cases of Ebola disease have been confirmed in the United States because of this outbreak. The overall risk to the American public and travelers remains low.
So CDC's What CDC is Doing page got refreshed yesterday, June 5th. And for an American listener, the headline is still the same 4 words. Overall risk remains low. But Kara, this is now the formal posture page, updated alongside the MMWR. Does having the science on record change anything about how the US screens?
Practically, not much. The MMWR is CDC putting its first formal epidemiology on paper. The case definition, the DRC and Uganda picture through May. The What CDC is Doing page is the public-facing companion. The screening posture itself is holding. Travel health notices for DRC and Uganda, enhanced screening, no confirmed U.S. cases. And look at what CDC lists as global support. Contact tracing, IPC, border health, sequencing. Those are exactly the pressure points where the field numbers look worst. Listing a capability is one thing. Getting it working in Ituri is another.
Right, because the page says, Infection Prevention and Control is a CDC support line, and Africa CDC is reporting 34 health workers infected, 7 dead. If IPC is what you're helping with, those numbers are the report card.
The Star, with Liu Fangqiang, Haptamu, and Shi Yu.
A total of 34 health workers have been infected with the Ebola virus so far, among whom 7 died and 6 recovered, according to the Africa Centers for Disease Control and Prevention, Africa CDC, and the World Health Organization, WHO.
Africa CDC gave us the hard count today. 34 health workers infected, 7 dead, 6 recovered. That's a case fatality rate above 20% inside the workforce you're depending on to run the response.
6 recovered out of 34. So most of the people who got sick are either still fighting it or already gone. That's the staffing math?
That's the staffing math. And you can't restock a trained nurse in Butembo the way you restock gloves. Kaseya also flagged a lack of countermeasures for the Bundibugyo strain, so the treatment side of this is thin too.
And Tshisekedi's move was to appoint a new military governor for Ituri. A general, not 100 nurses.
Ituri has 90% of confirmed cases and 76% of deaths. So putting a security figure over the epicenter tells you the conflict and the outbreak are tangled into the same problem on the ground.
If you have feedback, story ideas, or corrections for Ebola Watch, send them our way at ebolawatch@lanternpodcasts.com. We read every note, and your tips help keep the briefing sharp. You'll find links to every story we covered today in the show notes. If something caught your attention, they're there for a closer read. That's Ebola Watch for this Saturday, June 6th. This is a Lantern Podcast.